Hey everyone. It gets dark so early these days. It's kind of tough. Like when it's like barely dinner time and it's already like almost pitch black out. I have to tell you, I've been wearing N95 masks just to protect myself and protect my patients. And these are my favorite N95 ones that you can see here. But the straps are rubber bands and they often break. And so usually there's two, so I told my nurse, I was like, usually it's an N95. I've only got one strap, and so it's probably like an N92 or something like that. Just not quite as good, but still good coverage and everything like that. But I'm going to safely take that off because it's uncomfortable and wearing masks is important but sucks. I have been really impressed with how well our kids in general, and not just our personal kids, but kids in the community are doing. I have heard from so many families that wearing masks was not the big deal that everybody thought it was going to be. And frankly, at this point, when we are surging like we are in Nebraska, that like wearing masks in school is the least of anybody's problems. And I'm grateful that everybody just pitched in and said, this is hard, but we're going to do it. And now it's not the kids that have difficulty wearing masks. Like they come into the office and they don't sweat it whatsoever. There's no one that's agitated, upset, or anything like that. They just wear their masks because that's what they are supposed to do. That's what their friends are doing. No big deal. Okay, we're going to answer some questions. Now, if you have a question, you can text me 402 256 0768, and I will try at least twice per week to go through and answer all the questions that I get. It does take some time, and I apologize for that. And I set up a little filter, so if I don't answer your question after the first time, just add the word jerk, like JERK, in there, and then it will like notify me that somebody has called me a jerk, and then I will be more quick to answer it because then I will know that I have let you down by taking too long, and I won't be offended because I told you to do it. 402 256 0768, and that's where we're going to answer questions. So we've got a few that came in. Okay, this one is long. Let's see. Hi, Dr. B. We love following you. I was hoping to get your advice. Our 2 5-year-old. Oh, wait. I already did this question. Never mind. This one's already good. We did this one last week. Okay. Our sleep training skills usually fail when kid is sick, or now that he is getting his molars, it seems to be a more painful progress more than other teeth. When trying to get back on track, usually cry it out results in baby throwing up within the first few minutes and mom feeling really guilty for letting him reach that level of distress. Feel like I'm at a loss here. Any tips? Thanks. So, teething can be really hard, and it often is a time where parents kind of like do whatever they need to do to get the kid to go to sleep, especially when it's just really hard. So two things in particular that help with teething. Number one is recognizing that it's okay if we revert to some old habits when they're sick or when they're teething or when you're traveling or anything along those lines, because it doesn't throw them off in the long term to allow them a little leeway when things are not the normal routine. When it's every normal day, you do the normal things, but when you're traveling, when you're getting a tooth, when you have an ear infection or something like that, it's okay to resort to previous things that worked or doing what it takes to get some good rest for parents and kids. There's no need to be like so stoic or so guilt ridden or punitive or whatever you're feeling because of, you know, either letting them cry it out when clearly they're in pain, clearly they're sick, blah, 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 blah. You can just feed them if you need to. You can just cuddle them if you need to. You can just snuggle them to sleep, whatever it takes to get them to sleep in those moments. In general, what works best is ibuprofen or Tylenol before bed because throughout the night they have pain. And I talk about in my Mighty Sleepers course about like the typical way to tell, is it a cold, is it hunger, is it a tooth that's coming in, is it an ear infection, is it a growth spurt. We talk about all of that and kind of all the different regressions within Mighty Sleepers, but I'll tell you that teething, typically the pain is early to mid night pain. So we're talking like 12, 1 o'clock, something along those lines, where they have that pain and they're waking up. They're often also more fussy during the daytime. They're sticking everything in their mouth. They don't want to eat like normal. Those are all signs that they could be getting a tooth, in which case ibuprofen lasts longest and works best in my experience and my patient's experience. Tylenol is fine too. I don't mess around with Oragel or other teething things like that. Like those teething biscuits, which I think are like, there's teething biscuits, and then there's like teething chewy things that you freeze. Those are really fine in the short term. I don't like Oragel, one, because like it washes off the teeth, the mouth really quickly, and two, parents put too much on and it doesn't last for very long. There is some rare disease that you can get from it that is really rare. It's on the box. It's called methemoglobinemia, and it's really not likely to happen, but another good reason not to use something that I don't frankly think you need, and I've never seen patients need. Also, I will tell you, you do not need amber necklaces. Amber necklaces make no scientific sense. They put the child at risk for strangulation or burns to the neck. I've seen that happen where the parents think they're doing the right thing by getting the amber necklace, and then the baby gets their hand underneath it and tugs really hard and just like gives themselves this little really nasty abrasion, or even strangulation or other things like that, or it falls apart and they eat the beads. And there's just no scientific basis. I mean, we know in Jurassic Park that amber is good for collecting dino DNA, but otherwise it's great for decorating, terrible for helping with teething. It just is magical and doesn't do anything. What did I answer this question? I feel like I kind of went off the rails here. What you might try in this instance where you're finding that cried out results in baby throwing up, like nobody wants that. And that's just, not pleasant for anybody. I mean, he's still going to smile and be happy when you go in and see him in the morning, and he won't hold it against you that he threw up last night. But it's just a hot mess. And so what I would do is camping. Camping is a technique that I talk about in Mighty Sleepers, and I've talked about it on other videos too, where you camp in the baby's room. It doesn't mean you're holding them. It means you're nearby, within eye shot of baby. He can see you. He can be comforted by your presence, your quiet presence, like reading a book. Like I do this with our kids sometimes, and I'll just take my Kindle in there and I'll be like, yep, okay, read your book, be quiet, rest, and I'll just be reading my Kindle. And that works really well. Although I will tell you that Dorothy knows my password to unlock my Kindle, and she buys books. So about every week I have to go into Amazon and unbuy all these digital books that she has somehow figured out how to buy on her own. I need to change the password. I just haven't done that. And that's a good reminder to me to change my Kindle password so she can't buy all these books, because then it's just a hassle to go in and try and get credits back on digital purchases, blah, blah, blah. You camp in the room, you stay there until he falls asleep, and then the next night you can move a little bit closer to the door, and you just reinforce that over and over again. Hey, you can fall asleep on your own. Look, I'm getting closer to the door. Look, I'm in the hallway. Look, I'm down the hall. You fell asleep on your own, buddy, and you can talk them through that. It's normal, and it works really well and really quickly, and it can get them back on track, and it teaches them very gently you can fall asleep on your own. That would be my advice. It's no fun, though. Do you have any suggestions? Oh, this is such a good question. Okay, do you have any suggestions on what to give a nurse or respiratory therapist working with COVID patients as a little care package? Such a great question. Our staff in the hospitals, our staff in the clinics are burnt out. They are tired, and we are in the midst of the worst place we've been at in this pandemic in the Midwest. And so everybody is at their wits' end. Everybody is tired and fatigued, and it is really hard right now. And you want to do something for them. Like, does cookies help? Well, I did get some cookies today. I think, I don't have a picture of them, but I did get some pictures, or some cookies today, which was a nice, little thing from some patients, and things like that help. In terms of a care package, what can you do for them? Take something off their plate. Take something off their load, whether it be saying, hey, I know you're working a shift right now. I know it's crazy. I want to go to your house and do your dishes. I want to go to your house and do a load or two of laundry. Like something that just gives them a little peace and able to put their feet up. If you have the means, getting them their house cleaned, or, picking up dinner for them. Something where it's like, hey, I know this is usually on your plate, but I would love to take it off your plate. I think personally that means more. Now, comment below if you have an idea, because I would love to hear some other ideas for care packages or things that you could do to help those on the front lines that are really struggling right now. Will you take a moment and think of something and then comment below so we can get some more ideas? Because this is really what we need, and really what we need that we can do. Like, there are things that I can do and things that I can't do. There are things that you can do and things that you can't do. But if we can come up with some ideas like this, I think that would be so valuable and appreciated by those on the front lines, that here's things that we can do. And it's almost like thinking about back in World War II. Most people could not go to war because they were too young, they were female, they had, they were out for some reason, but they could still help the war effort. And this is helping the war effort. This is the victory garden. This is conserving our valuable resources. And at the end of the day, just a text message, just reaching out and saying, hey, I know that you're really struggling right now, or you must be exhausted right now. I'm thinking about you. I'm praying for you. I am here for you if you need anything, and I'm thinking about you, and I appreciate you. If you can share that message with those on the front lines, that will go further than any cookies, although I will never turn down cookies. Anything that you can do for them in terms of like physical care packages and stuff like that. I mean, if you know they like something, if you know they haven't had a chance to go to the store and get something or do something special that you're able to safely do, great. But I think there's a lot more that can be done, from taking things off their plate and then emotionally checking in and being present for them. And that's what's really going to help those on the front lines right now. And then taking it seriously and encouraging others to take it seriously, because seeing patients that have COVID, seeing patients where you wonder if they have COVID, taking care of these sick patients is one thing, but seeing people not taking it seriously, seeing people think it's a joke, or, well, I'm just going to do what I always do, or I don't have to wear a mask because it's not going to bother me much. I mean, those are the things that really, like, Dementor suck the life out of my medical practice soul, is like the way that people don't take it seriously. And my blood pressure is going up, so I'm going to stop talking about that right now. But that's really like taking it seriously, showing others how to take it seriously, connecting with those. I mean, those are the things that you can do. I'll stop right now. I saw your post about going into the red. That's what we have done here locally in Lincoln, and agree with everything you say, but is a small group, even like my parents. They help me with my kids a lot, so wanting to make sure I'm doing it right for the community. Also, Thanksgiving. My family, 2 adults and 3 small children, and my parents, and my sister's family, 2 adults and 3 kids, and no. Waiting to do my part and trust your advice 100%. Thank you. I appreciate and feel privileged to have your trust. I released on Tuesday night my Thanksgiving video. The bottom line is, I don't think that people should get together in groups of non family, the people that you live with, for Thanksgiving this year. And the reason for that is because it is too easy, even when you're doing small group gatherings, to have exposures. Our governor was exposed to somebody he had dinner with the night before. There's just a million examples of people that we got together the next day, somebody had a fever and a cough, and they tested positive. We just see that so stinking much right now that I just really don't feel like it's safe at this moment to be doing those sort of get-togethers of any size, and things just are getting worse and escalating more, and our positivity rate is out of control. And so I would encourage you and ask you and plead with you to please just stick to your own family for Thanksgiving. I talked in the video, and check out that YouTube video if you have further questions, or you have some specific ideas. Comment below if you have an idea of what you're actually going to do for Thanksgiving, and comment yes if you're willing to do the hard thing, which is to not get together with family this year. It is hard, but I think that it is truly important, and is truly what's going to help us to move through this and not get even worse than we are now, because we are already at a really bad place right now. Now, the first part of your question, going backwards, is people that help watch my kids. I don't think that you have to say babysitter, nanny, grandparent, somebody that watches your kids so that you can do what you have to do, which is go to work. Those people don't count towards small group gatherings. Now, what can you do to keep them safe? Well, if they're out and about, really trying to talk with them about, hey, I know that you like to do this and this and this, but really we want you, we need you. Can you please pause on this thing that you like doing for a little bit, because we want to have you around our kids, but we don't want you to get sick. We don't want our kids to get sick. We don't want to have to quarantine and be away from you. Can you take a pause from this and let me help you set up a Zoom meeting with so and so, and so that you can get together and connect and socialize? That will go a long way to helping. But those that provide childcare for your children, those that allow you to go to work, I think it's okay to include them. I would just really try and figure out how we can work together to bubble so that they aren't putting you at risk and you're not putting them at risk, because we do literally still have to live our lives and go about like doing the things that we have to do to support our jobs and lives and the people that count on us and the people that we count on, and all those things can continue in a safe way. We just have to be thoughtful and cognizant about how to do that safely. That's my thought. Okay, what are reasonable expectations for a 3-year-old, or what is not reasonable to expect from a 3-year-old? I want to have reasonable expectations for my, and it got cut off, but I know it says son. This is a really broad question, so I have a little bit of trouble knowing exactly like what those things are. But in general, I would say a 3-year-old has the ability to share with you their emotions of how they're feeling. A 3-year-old has the ability to say, I'm angry, I'm sad, I'm hungry, I'm upset, I'm happy. And working on those things with your 3-year-old is probably the most important thing that you can do, is helping them to realize and acknowledge and understand how they're feeling about the things that they are going through. In terms of like, what are the expectations? What can I expect of them? Well, it varies a lot. Some 3-year-olds are really, good at following directions and doing what you ask of them some of the time, and some of them really have a hard time with that. A lot of the 3-nager year is about power and setting reasonable boundaries. Power means giving them power when you can. Do you want to wear a red shirt today or a blue shirt today? Wow, good job picking that shirt. I am really proud of you for picking that. What a good shirt. Let's go show mom, dad, sister, brother, whatever. Control, and that is another thing where 3-year-olds like to have control. So you give them control when you can. You keep control away from them, and you keep the control away from them when you need to be in control, and you are able to compromise a little bit and give a little bit and take a little bit. 3-year-olds have tantrums. 3-year-olds melt down. 3-year-olds don't do what you ask of them. They talk back. They ignore you. Those are all normal things that 3-year-olds do, and you don't have to try and fix them in that moment. I think the one real struggle that families have is, hey, he just did that, and that's not okay. So he's going to say he's sorry. He's going to apologize. He's going to write me a letter about what he did. He's going to write a dissertation about how he's not going to do that again and how disrespectful that was. Well, when they're at that point, they're probably not in a good place to share those sort of things with you. And so I wouldn't go there and expect them to do that in 3, 4, 5, 10. I mean, your coworkers at work probably, to some extent, your family members, the people that you love, are not probably in a good place when they're acting out or having a tantrum or having a bad day to hear the lesson. So hold on it, wait until it's a better time, and then bring it up. Hey, remember yesterday when you were really upset and it seemed like you were having a hard day. Were you having a hard day? Oh yeah, you must have been hungry because it was after school and we were really busy and I asked you to do 3 different things and you got really upset and you threw the remote control. Do you remember that? That must have felt really scary to feel like you're not in control and you decided to throw the remote because you didn't know what else to do. Now, what could we do next time to make things go better? If you can approach it from that, then 3-year-olds learn to acknowledge and see what their emotions are, and then they learn how to say, hey, I'm getting upset, I'm getting angry, maybe I should tell my mom or dad about that, maybe I should take a step back. Like, those are things that it takes a while to learn, but if you start at 3, then you'll be in much better shape than a lot of 30-year-olds even. So that would be my advice. That's what I think a 3-year-old could do. Comment yes below if that makes sense. If that is something that, okay, in the past I have felt like I need to immediately fix this and I need to teach them a lesson. Comment yes if that's been you in the past and now you're willing to say, okay, I want to teach them a lesson, but I'm going to take a pause for a moment and talk to them about it later when we both have cooler heads. Now, those are the questions that I got. I can't wait to get more questions. I love doing this. Hopefully this has been helpful to you. If you have a question, text me and my gross dirty phone and I will answer it. 402-256-0768.